Good afternoon, everyone. My name is Dr. Benedict Idowu. I'm a neurologist and in private practice in Baton Rouge. I'm also an emergency room physician, and I've been practicing in that capacity for the past 7 years or so, and I've also been practicing in my capacity as a neurologist over the past 20 years. Today I'm going to be talking to you about my personal experiences in terms of the coronavirus. And I'm going to try to do so in a layman's term. In other words, I'm going to talk to you as if I'm talking to someone who is not in the medical field. I believe that by doing so, I'm going to make it as simple and as understandable as possible. As we all know, the coronavirus has been a pandemic over the past 6 months or more. The effect of the coronavirus has been seen everywhere. And in my practice as an emergency room physician, I have come in contact with patients who either have symptoms of the coronavirus or are presented with concerns about being exposed to the coronavirus. The signs and symptoms of the coronavirus infection are not particularly different from ordinary garden variety of respiratory illness that we see in our usual practice. I say this to say that the patients who present with coronavirus infection, they have very similar symptoms as patients who come in with other respiratory problems. So what is important for you as a lay person is to know when you should be concerned about your own particular symptoms. If I have been coughing for a few days and I have mild fever and body aches, I probably would not worry about it, simply because it is what one normally sees under ordinary circumstances. But if I have the same symptoms and I also have diabetes, I have high blood pressure, I'm overweight, and I'm having shortness of breath, I'll be concerned about it, because in this time and period of the corona pandemic, one must rule out the possibility of COVID-19 infection. Notice that what I'm trying to emphasize here is the presence of other chronic medical conditions, such as the high blood pressure, diabetes, being overweight, make it more likely that my symptoms will be related to COVID infection. So I would be the type of patient that needs to be paid attention to. In the emergency room setting, when we see patients like me come in, the first thing we want to make sure is that they are not having difficulty breathing. By that I mean they breathe quite all right, but they are not maintaining good oxygen level in their systems. Someone who breathes normally, who has no problem, in their system, their oxygen level should be very high, more than 90. And the percentage of saturation should be more than 97. if they're wide awake and breathing. However, when these patients present with oxygen levels that are less than 80% saturation, and they have these other symptoms, we start getting worried. These are patients that we admit to the emergency room and have a full workup. And that workup will include doing chest x-rays, doing blood gases, and doing other blood work to see about their ability to maintain oxygenation. We'll look at the white blood cell count to see if those are elevated. The white blood cell count will be elevated in someone who has an infection that has affected the rest of the body systems. So you want to look at their blood count, make sure it's not elevated. If it's elevated, then you know you're dealing with something more serious than just a common cold. Like pneumonia, patients who have been exposed to COVID and are infected by COVID and are sick because of COVID will have changes that we can pick up from laboratory work, such as chest x-ray, blood work. And in those patients, what we do is, if it's a matter of supplementing the oxygen, we do that. If it's a matter of supporting the airway, we do that. And the way we support the airway in patients who are actually going into respiratory failure is to put a tube in the trachea and give them air, meaning put them on the ventilator. For the most part, these patients do well if they don't have any serious underlying medical conditions. Because a great number of these patients come in with pneumonia, we treat the pneumonia. The pneumonia that we typically see in these patients are the atypical pneumonias, which we treat with antibiotic. Now, in terms of other medications, of course, there is the controversy about hydroxychloroquine, and there's also the introduction of new medications like remdesivir, which has been shown to help. In my practice, in my emergency room settings, we don't have patients that have to be treated with these medications. Our patients are mostly ones that need to be stabilized and then moved on to a higher level of care, such as the such as the ICU. My emergency room practice is essentially what we refer to as access to critical care, meaning that we are the ones who see patients, who determine whether or not the patients are critical, and if they are, give them access to critical care. So our job essentially is to stabilize these patients. By stabilizing, I mean if they need oxygen, we give them oxygen. If they need IV fluid, we give them IV fluid. If they need relief of difficulty breathing, we support that by what I call what I referred earlier as putting a tube in their trachea, intubation. So if you ask me what should be more important to me as a layperson presenting with symptoms that are similar to COVID-19, And my answer to you would be, yes, you have fever. Yes, you have cough. Yes, you have body aches. But do you also have difficulty breathing? If the answer is yes, the next question is this something new for you? Do you have chronic obstructive lung disease? Do you have asthma? Have you been diagnosed with congestive heart failure? If the answer to any of this is yes, what's going to run in my mind is narrowing my search to this underlying condition that you have. But if you're a young person and you do not have any of this, and you're having shortness of breath, you're having fever, I'll be concerned about COVID-19. Definitely. So the take-home message is, anyone who does not have the risk factor for being short of breath, and what are those risk factors? They would include having congestive heart failure. They would include having a history of asthma. They would also include having the tendency to have blood clots, because anyone who is otherwise healthy and all of a sudden becomes short of breath, one of the first things that we think about is whether or not they have a blood clot. And interestingly enough, one of the conditions that the infection with coronavirus can cause is the development of blood clot. So if you have a young person who is otherwise healthy, no risk factors, and comes in with fever and shortness of breath, you start thinking about, did this person just develop a blood clot as a result of infection with COVID-19? Or is this shortness of breath from pneumonia that is caused by the virus? Or is it from pneumonia that is not caused by the virus? So this patient gets a chest x-ray. If the chest x-ray is equivocal, meaning that it doesn't tell us one way or the other, sometimes we do a CT scan, which most of the time will tell us if there is infection in the lung and what type of infection. There's a typical presentation of the findings in chest x-ray of a patient who has the coronavirus infection. If we see that in chest x-ray, and we see changes in the patient's ability to maintain good oxygen, chances of being infected with coronavirus becomes high. And because today there is not a medication that is indicated for the treatment of coronavirus infection, in other words, there is yet to be the study of a particular medication that had passed the gold standard for such study to make it be indicated for coronavirus. We say that there is not a treatment, there's not a medication indicated for the treatment of coronavirus. And that's the argument that's being made right now. Hydroxychloroquine can help. However, it has yet to pass the gold standard in terms of determining whether or not it could be indicated, it could be selected as an actual treatment for the coronavirus. At this point, I would hand you over to my colleague here, Dr. Anyanwoke, who is an infectious disease doctor, and she can tell you more about this. And if anyone in the audience has a question for me, I'll be glad to answer it at this point. Again, thank you very much.